Have you ever wondered how a person can show traits of both narcissism and sociopathy, and what that might mean for their relationships and interactions? This is a question that leads us into the murky world of narcopathy. Narcopathy, a term not often heard, is a blend of two distinct personality disorders: narcissistic personality disorder and antisocial personality disorder, commonly known as sociopathy. It's an unofficial term not recognized in the Diagnostic and Statistical Manual of Mental Disorders, but it's used to describe individuals who display characteristics of both disorders. A person with narcissistic personality disorder often has an inflated sense of self-importance, a deep need for excessive attention and admiration, troubled relationships, and a lack of empathy for others. On the other hand, a person with antisocial personality disorder tends to disregard or violate the rights of others, lacks remorse or guilt, and exhibits impulsive behavior. So, imagine a person who combines these traits: a grandiose sense of self-worth, lack of empathy, disregard for others, and manipulative tendencies. This is the essence of narcopathy. The impact of narcopathy on an individual and those around them can be profound. The lack of empathy and inflated self-importance can make it difficult for them to maintain healthy relationships. They may manipulate others for their own gain, be impulsive and reckless, and show little or no remorse for their actions. This can lead to loneliness, strained relationships, and a life filled with conflict. But what if you find yourself dealing with a narcopath? First, it's important to understand that it's not your responsibility to change them. Mental health professionals should handle diagnosis and treatment. If you're in a relationship with a narcopath, consider seeking help from a mental health professional for guidance and support. Now, suppose you're wondering how to avoid becoming a narcopath. In that case, it's about fostering empathy, self-awareness, and respect for others. These traits are often lacking in narcopaths. Cultivate emotional intelligence, practice mindfulness, and consider therapy to address any underlying issues that may contribute to narcissistic or sociopathic tendencies. In conclusion, narcopathy is a blend of narcissistic and antisocial personality disorder. It's characterized by a grandiose sense of self-worth, lack of empathy, disregard for others, and manipulative tendencies. It can have a profound effect on individuals and their relationships, leading to loneliness, conflict, and strained relationships. If dealing with a narcopath, seek professional help. To avoid becoming one, foster empathy, self-awareness, and respect for others. Remember, understanding is the first step to acceptance, and only with acceptance can there be recovery. So, let this understanding guide you in your interactions and self-reflections. After all, the complexity of the human mind is a fascinating realm to explore.